These doses are already in short supply, but next week it gets even worse.
Next week's deliveries have been deferred by Pfizer in their entirety.
By deferred, he means canceled. Canada won't receive a single dose from Pfizer during the week of January 25th. That follows an 18% reduction this week, with smaller than expected shipments to come in early February.
I spent the weekend on the phone with Pfizer executives and my team. We reiterated firmly the importance for Canada to return to our regular delivery schedule as soon as possible.
The reductions are the result of work to expand production at this Pfizer plant in Belgium. Several European countries have also been hit with delays, but only for a single week. Canada's supply is being disrupted for a full 4 weeks.
We'll have to adjust accordingly, and every time we get news that we're getting less vaccine, that news is obviously disappointing.
I'd be on that phone call every single day. I'd be up that guy's yin-yang so far with a firecracker he wouldn't know what hit him from Pfizer. I would not stop until we get these vaccines.
The assurance is that Canada will get back on track when the Pfizer plant gets back online.
The companies are respecting the contracts that we've signed.
And Trudeau says these doses are merely delayed, not canceled.
With every Canadian who wants to get vaccinated, able to get vaccinated by September.
Okay, so David, help us understand one thing here. The PM says Pfizer is respecting its contracts. How can that be if they aren't making deliveries?
Yeah, so the contract says that Pfizer has to deliver 4 million doses to Canada by the end of March. It does not say specific doses in specific weeks. So deliveries are going to have to ramp up quite considerably after about the mid part of February. But if they can get 4 million doses here by the end of the first quarter, they live up to the terms of the contract.
So then bottom line, what is the impact of this break in supply?
Yeah, so this supply interruption is going to be a pretty significant disruption, at least in the short term. The bottom line is that this is about 570,000 fewer doses over the next 4 weeks, and that's going to force health authorities to cancel or delay vaccination appointments for people like frontline healthcare workers and vulnerable Canadians like people who live in long-term care. So this is particularly bad news at a particularly bad time.
Okay, David Cochran, thank you, sir.
You're welcome.